رسول الله أشهد أن محمد رسول الله.
The month of Ramadan is a unique month for Muslims, and it has a number of significance for Muslims. Our eating patterns, our sleeping patterns have to be changed to accommodate the concept of fasting. Allahu Akbar. Usually we eat 3 times a day. In the month of Ramadan, when you're fasting, when you can't have food, you can't have drink, you cannot have marital relations with your partner, from dawn to sunset. That's a long time, and in summer that can be about 17-18 hours. Now if you're not feeling well, then obviously that presents a challenge. Now Islam doesn't want you to starve to death. It doesn't want you to risk your health, and as a result there are concessions in the Quran whereby if you're not feeling well, if you are medically ill, then you don't have to fast, and those exceptions are set out in religious scriptures. So for instance, if you're pregnant and that's going to affect your own health and also the health of baby, then Islam says that you shouldn't fast. You can pay charity or you can make up your missed fast afterwards. Similarly, if you are on serious medication, which is going to, if you don't take that medication, that's going to deteriorate your health, then on the basis of necessity, Islam says that you shouldn't fast. That's an exception that's given to you. How do you feel when the month of Ramadan is upon us, and how do you physically, if you are ill or if you are not so healthy? Now in terms of if you were applying lotion to your hands or to parts of your body, Islam would allow that. So it's really the key principle is the necessity. The aim of fasting is to really detox your body, to cleanse yourself. If you are actually putting your health at risk, putting your life at risk, then that's not what the requirements of fasting are, and that's not what the divine plan is.
I think if you have to take medication, then it's not your fault. It's your intention. You wanted to fast, so your heart's in the right place.
Yeah, at times my mum tries to fulfill a fast. However, at times she needs to take a medication, so she's not able to do that.
As an imam, my advice to the pharmacy team would be to start the conversation with their local patients early on, well before the month of Ramadan, so that they can learn about the concerns that their patients have, because ultimately they need to make an informed decision on the basis of the advice given by their local pharmacists, whether or not they should be fasting and whether or not them fasting is going to deteriorate their health.
Has this patient had this before?
Yeah, I have, yeah.
Okay.
A lot of our patients in community pharmacy we see on a day-to-day basis, as it is, they're coming in every day either for just basic advice or just to collect the medication. And I suppose during Ramadan it's how we can sort of utilise that position we've got and ultimately provide a better service, a better level of service during that particular time, especially in certain areas, within certain high-risk groups. Community pharmacy, how we can help during Ramadan is quite simply just asking a question around how are you getting on with your medication, are you comfortable taking your medication around sort of this period, or have you got any questions? So keeping it quite open, quite relaxed, and that should hopefully engage in a two-way conversation, which ultimately identify if there is any issues, we can deal with them. That should last them about anywhere between 3 to 4 weeks.
That's lovely. All right then, thank
Cheers.
you.
A lot of these are polypharmacy patients, so they're on a number of medications. So I suppose during Ramadan, and especially in particular areas, they are at high risk. And for us as community pharmacists, it's just looking at, I suppose, how we can engage with these patients and ultimately letting them know that we are here to help and we can offer some professional and reliable advice. The risk patients we're looking at are people who are taking blood pressure, asthmatics, diabetics. They're probably the particular risk patients that we're identifying. So it's looking at educating the patients around the effects of missing these doses. I suppose during Ramadan, the whole principle of it is to be a better person and look after your own health as well as others. So I suppose with that in mind, in community pharmacy, we're looking at the services that we offer. So be it, I've decided to stop smoking, we can offer a stop smoking service, there's a weight management service, and if not, we're in a fantastic position to actually signpost where you need to be. So, there is a lot of NHS services out there, and again, it's a good opportunity from our side just to signpost them where they need to go.
If you've given the advice on medication and you feel that the patient is still in doubt, is still not sure whether or not they should fast, perhaps you can suggest to them that they can speak to their local imam so that they can take advice on the tenets of their faith. Because obviously from faith point of view, imam would be saying that the key issue is that you shouldn't be risking your health. And once the advice from the local pharmacy team has been given to them and imam's advice has also been given to them, I'm sure they can make a very well-informed decision as to whether or not they should fast.